You're listening to FMGRadio.com. Are you ready to take control of your physical, emotional, spiritual, professional, and financial health? Are you ready to experience great success in your life? Each week, join Dr. Diane A. Thompson and her guests for tools and strategies to help you take control of your health and inspire you to live your best life. Now here is your host, Dr. Diane A. Thompson.
Well, hello and welcome to Health Talk with Dr. Diane, MD. This is a show that's designed to inform and inspire you to a healthier lifestyle. I am your host, Diane A. Thompson, MD, and as always, it is my pleasure spending time with you on this broadcast with the goal that you will learn something that may take your health and your life to a higher level. I realize that you could be someplace else, and many of you come here every single week, and I want to let you know that I really, really appreciate this. I'm very grateful. Hello. Thanks for being here. Let me just remind our listeners of the disclaimer that, in fact, this broadcast is for educational and informational purposes only and not intended for diagnosis or treatment. So please consult with your healthcare provider before making any changes to your health. All right, and so we have an amazing show. We're talking about our oral health with Dr. Alex Shvartsman.
You have to I believe people need to take charge of their health. The days that we go to the doctor, and the doctor knows everything and tells you what to do, and you just go, and do it, I think those days are over and should be over.
I agree. I totally agree with you on that, yes.
Because the problem is, unfortunately, the way medicine is today, in my opinion, it's mostly cut and drug. Cut and drug, cut and drug, cut and drug. And I think there's too little of treating symptoms. I mean, there's too much of treating symptoms and too little of treating the cause. Mm-hmm. For instance, if somebody is a type 2 diabetic, they're going to throw all kinds of drugs at them and really not discuss dietary intervention, which is the cause of type 2 diabetes in the first place. You know, instead of taking metformin and insulin, you should be maybe controlling your carb intake, which is what was the cause of the disease in the first place. But what's the solution in modern medicine? Eat your brownies and pump more insulin in there. I think that's wrong.
Yeah, I agree. Again, this is Dr. Alex Shvartsman, and he's a holistic dentist and the author of the book, Your Path to Healthier Dentistry, a holistic approach to keeping your teeth for a lifetime. On the second half of our program, I want to continue to talk about some of the dental treatments that are out there and to talk about, some of them are kind of controversial, and of course there are also some newer technologies out there. So let's go back to something you talked about earlier, that of fluoride. I remember as a child, they made sure that the water had fluoride. We would go in for fluoride treatment. What are your thoughts on fluoride?
Okay. So if you go on the Internet or if you read a book on fluoride, you're going to read about all the horrible things fluoride does to us. You know, the thyroid issues, the bone brittleness issues, and various other issues. And everything you read about fluoride is true. But the key thing to understand about fluoride is everything you read about fluoride has to do with systemic fluoride. In other words, the fluoride that you swallow, that you ingest. So I think water fluoridation was one of the worst government health experiments on the public in the United States. It's a terrible thing. Because one of the things is fluoride does nothing to help the adult population. You could make the argument maybe about children, but for adults it does nothing except harm them. So why would you put fluoride in the water that will harm the adults? And people, there are towns and states all over the country that are fluoridating their water. And the people that get hurt the most are the poor population, people who can't afford to buy, Poland Spring water. They drink tap water. But the problem is you cook with it. And what people don't understand also is you don't know where your bottled beverage is bottled. So if you're drinking a soda or some kind of juice from concentrate, there's no government regulation to tell you that the water that was added to the drink has fluoride or not fluoride. So no one really knows what you're getting, and that's a problem. Now, here's the other side of the fluoride coin. The other side is when fluoride is applied to teeth, it's actually beneficial in reducing tooth decay. So when you apply fluoride to teeth, it actually helps to heal tooth decay in the enamel layer. And when the enamel gets healed by the fluoride, when the fluoride gets incorporated into the crystal structure of the tooth called fluorapatite, that healed area of the tooth becomes highly acid resistant. In other words, it's harder to get a cavity in the same spot. So the big question that people should be asking themselves right now is, well, when you apply fluoride to teeth, whether it's in toothpaste or rinse, and you apply it for about a minute to 2 minutes, and you spit it out and you rinse afterwards, how much of that fluoride gets absorbed by the gums and the cheeks? And that's the real important question. In other words, what is the systemic effect of fluoride applied directly to the tooth and then not swallowed or not ingested? And the answer is there's no study out there that shows that there's any systemic effect of topically or tooth-applied fluoride. So what's happening is you have people who go on the Internet and read books and learn about the ill health effects of systemic fluoride, and they right away assume that it gets all absorbed into your body from brushing your teeth or rinsing with it. And so what they do is they discontinue fluoride use, and then their tooth decay goes up, and their mouth gets devastated. That's the problem.
Okay, so
People
yes
don't
to the
understand.
topical fluoride.
I would say yes.
Yes to the topical,
here's
but
the
no
thing.
to the systemic.
Exactly. So here's the thing. Everyone has different risks. So if you're someone that has never had a cavity all your life, then you don't really need topical fluoride. However, if you're someone that every time you go to a dentist every 6 months or every year and you get a couple of cavities, you know what? You're high risk of tooth decay, and you should use preventative measures. Now, I would like to, so that's kind of my opinion. You can't just say carte blanche to everyone, you got to brush with fluoride, you got to rinse with fluoride. You have to look at it on a case-by-case basis. So if you're somebody that always gets cavities and don't use fluoride because you're terrified of its systemic effects, well, don't drink it, don't ingest it, but you may want to use it on your teeth.
Okay,
so
what about,
let's
move on to another topic, just because we're running short of time, and I wanted to make sure we cover quite a bit for our listeners. Yes. Another common thing that we see is teeth whitening. Now, you can walk in any supermarket, any pharmacy, down the aisle. There are all sorts of teeth whitening products out there. In the malls, they have stalls dedicated to teeth whitening.
Ships, sure.
So,
yeah, that's a great question.
Is this safe?
So here's the thing. What studies show is that people who have nicer teeth or straight teeth and white teeth, they actually are perceived as more intelligent. So somebody that has like bad yellow crooked teeth are, unfortunately, the perception is reality. And I hate to say it, as people with crowded and crooked and yellow teeth are perceived as less intelligent and less attractive to the other people. So a lot of people want to do is they want to whiten their teeth because they understand that, or they understand that they will look better with whiter teeth. So all tooth whitening, works through a peroxide gel. Now, the difference between over-the-counter products and dentist-supervised products is the concentration of the gel. Now, I can't really speak about over-the-counter products because I really don't know the concentration of the gel in those products. And a lot of the over-the-counter products, what they do is they add acid to the product because acid can frost or etch the tooth, kind of like if you've seen frosted glass, it appears a little whiter.
Yeah.
So you actually destroy the outer layer of the enamel with acid to give like a false whitening effect. And I think that's a problem. So I think if you're going to whiten your teeth, then I would say go with a dental supervised whitening. So there are basically two types of whitening, three types of whitening that's available through the dentist. One is a low peroxide concentration gel that is applied into a soft silicone tray that's custom made for your mouth, almost like an Invisalign retainer or like a night guard, almost like a very thin night guard. And the studies that actually tooth whitening is probably the most studied dental procedure ever. Mm-hmm. And we have about 25 years of research on tooth whitening. The low concentration overnight whitening. Then what happened was people wanted, especially Americans want everything done yesterday. We want it quick. So what companies started doing is they started upping the concentration of the gel and lowering the application time. And what happened was, what we learned over trial and error is that the higher the concentration and the shorter the application time, the worse the results. So the best way to whiten your teeth is using at night, low concentration, low side effects gel. The next choice is to use a daytime gel, which is applied between 30 minutes and an hour, but it's higher concentration, more side effects, less whitening effect. And I would say the worst way to whiten your teeth, which happens to be also the most expensive way to whiten your teeth, is in a dental office. That's what's called power whitening, where they apply the gel to your teeth and they shine a bright light on it. The problem with this technique is that,
let me just clarify. You said that that's the worst way to do it.
That's the worst way to do it.
Okay.
And the reason is, the way tooth whitening works is, when you apply the gel to the teeth, it breaks up into oxygen and other byproducts. And the oxygen begins to slowly diffuse through your enamel into the core or the center of the tooth, and it actually lightens the dentin, because enamel is basically translucent or relatively clear. What you're whitening is actually the inside of the tooth. And so, but diffusion, as we all know from high school chemistry, takes time. And so what studies show is that the more you whiten your teeth, the longer the application time, the more your enamel actually becomes permeable to oxygen. So if you're doing the at-night low-concentration gel, you're giving the oxygen time to diffuse and to whiten the tooth. So the reason in-office 1-hour whitening is the least effective is because, number one, you haven't given the gel or the oxygen enough time to pass through the enamel, and because you've never whitened teeth before, your enamel is not oxygen permeable, so the effect is the worst. But what happens is it's very popular because people want a quick effect and a quick result. And the other problem with in-office whitening is the light has been shown in numerous studies to have zero effect on tooth whitening. In other words, it's an expensive gimmick. And that's one of the other dirty little secrets of dentistry, that all those fancy lights that you shine on teeth during tooth whitening are just for show. They don't do anything. And there's
I'm sure my listeners are very happy they tuned in today. Because many times this is what we're told.
That's the problem. It looks fancy. It looks like it's a gizmo. A lot of dentists call it a laser, when in fact all it is a blue light, a filtered blue light, and it doesn't do anything. What it does do, it dries out your teeth. And what happens is, if you take a rock, if you go to the street, pick up a rock, and wet half of the rock, the wet side will look darker than the dry side. And that's called desiccation, or drying of the tooth. So the dry side is actually lighter than the wet, dark side. So when you sit, underneath that light for an hour with your teeth exposed to air, basically, and your tooth enamel dries out, when you take the gel off and you look in the mirror, and a dentist will run and give you a mirror immediately after it takes the gel off, the teeth actually appear whiter, and they look great. But it's a false positive, because what happens is after about a week, when your teeth rehydrate, that effect goes away. And there was a study that just recently came out of the University of Ohio that showed this effect. And what the study showed is that, light-assisted power whitening, people got better results in a week, but at week number 2, the results were the same, light or no light. So there you go. You have to look at the data.
Yeah, this is really great information you're sharing with us.
So if you want to whiten your teeth, I would say the safest way is go to the dentist, have a mold taken, and choose the cheapest, least expensive, at-home, nighttime whitening. And the little tip for patients is the only side effect of this technique is some transient tooth sensitivity. It lasts for about, if it happens, it lasts for about 3 to 5 days. However, if you use any toothpaste for sensitive teeth like Sensodyne or any other brand that's for sensitive teeth, 2 weeks prior to whitening and during the whitening, that tooth sensitivity will be greatly, greatly, greatly reduced, if not eliminated.
All right.
So that's my little tip of the day.
I like that. So again, this is Dr. Alex Shvartsman, and he's a holistic dentist and the author of Your Path to Healthier Dentistry, a holistic approach to keeping your teeth for a lifetime. I wanted to ask this question because a couple of people actually asked on my Facebook page as well as emailed me about it, and it is the question of bad breath. They say, hey, I brush my teeth all the time, I floss. Is there something I can do because my breath still doesn't smell fresh? So what is the cause in many cases, and what is it that people can do to help prevent halitosis?
Well, as we all know, there are certain foods that cause bad breath, garlic and onions, and that's because they contain sulfur compounds. What's interesting is there are sulfur compounds in 2 amino acids that we eat, and some of those amino acids get trapped in our gums, and they release what's called volatile sulfur compounds, and there are actually rinses that can neutralize these compounds, but that's kind of rare. It's kind of like when you try everything and nothing works, it's probably the volatile sulfur compounds, and there are various rinses that are available, and you could ask your dentist about it. Your dentist should know about this because the phenomenon has been written about in the dental literature a lot. So one of the other reasons, and I think the predominant reason why people have bad breath is there's a lot of plaque on their tongue and or they have active gum disease. So let's talk about the tongue because that's a really easy solution. Go to any pharmacy or on the internet and buy yourself a tongue scraper. If you stick your tongue out and your tongue is covered in a film, it's covered in bacterial plaque, basically. A lot of people misdiagnose themselves and they think it's candidiasis or yeast infection. But I would say 99% of the time it's just plaque gathering on your tongue because your tongue is made of little tiny projections called papilla, and they trap food particles and bacteria and plaque. And if you get a tongue scraper and you just scrape your tongue in the morning and before you go to bed and look at what's on it, you will never, ever stop doing that because it's really remarkable. I'm amazed by that all the time. And what happens is when we speak, and especially when we speak a lot, our mouth gets dry. And just like, when you have low tide and you walk on the beach, it's a little stinky. Well, if you look at the back of your hand, let it dry and smell it, it's going to smell like the beach at low tide. So one of the things so when you have this kind of schmutz on your tongue, this plaque on your tongue, and you're talking a lot, and your mouth gets a little dry, it's going over this plaque layer, and your breath can be perceived as bad. So scrape your tongue. If you talk a lot, like we're doing right now, drink plenty of water. The other main reason, probably I would say the main reason for bad breath, is gum disease. And gum disease, what studies shows that about 85% of the population have some stage of gum disease. And that's a whole other topic in and of itself. But there's something that dentists refer to as perio breath. Now, perio means gums. And so people who have active gum disease have a very distinct bad breath. And one of the best things you can do is go to the dentist and actually have a gum evaluation or gum exam where they measure the gums with a round-ended ruler and diagnose you if you have gum disease. And if you do, there's various therapies that are available today to treat gum disease. Among them are non-surgical therapies and also surgical therapies. However, there's also laser-assisted gum disease treatment, which is phenomenal because it's minimally invasive, which is right up my alley, and it kills the bacteria underneath your gums. And there's several lasers out there that help to treat gum disease. And the studies have been very, very, very supportive of this technique. So you don't have to have your gums sliced and sutured and stitched anymore. You could have laser therapy to treat gum disease. So A, get a tongue scraper. B, drink plenty of water if you talk a lot. And C, make sure you don't have active gum disease.
All right.
And I would say probably 90% of the time that'll solve your problem. You know, it can come from the stomach, but I would say that's the exception, not the norm.
Okay. Great advice there. Give us a glimpse of the future of dentistry.
Oh, it's so exciting. I'm so excited. I think what's going to happen, and I really hope this happens in my career, in my lifetime, I hope I live to see this, they are growing teeth. They are bioengineering teeth. This work is being done in Columbia University in New York. This work is being done in China and in Japan. And I've already seen, pictures of bioengineered teeth. So someday, if you lose a tooth, you're going to go to the dentist. They're going to, swab your cheek, collect some cells, and grow a tooth bud, or using stem cell therapy. And today you could actually get stem cells from fat, so you can get a little liposuction, and you can actually get stem cells from that, and you could actually grow teeth. What's emerging right now in dentistry is something called CAD/CAM dentistry, which is computer-assisted design and computer-assisted milling, which is basically, instead of taking those goopy rubber molds of teeth, we could actually take a three-dimensional scan of your tooth, design the missing part of the tooth in a computer, mill it out of beautiful porcelain, and bond it into the tooth right in one visit. And this is the type of technology I actually use in my office, and it's called CEREC. And you can actually have crowns, veneers, onlays, partial crowns, porcelain fillings made in one visit, versus before it takes 1 to 2 to even 5 visits. And today I'm actually making bridges with using this technique. And what's great about this technique is that it's super accurate. In other words, the restorations fit perfectly onto your teeth. The other emerging field in dentistry are lasers, and there's many different types of lasers for many different approaches. And basically, so laser dentistry is the future. And one of the other things that's coming down the pike is plasma. They call them plasma drills, but they're basically little mini plasma torches that are cold. In other words, they don't heat the tooth, and someday we'll be treating cavities with a plasma knife. So that's coming down the pike. Another great modality is ozone. Unfortunately, we're one of the few countries in the world that FDA has not approved ozone for dental use. Now, what ozone does, it kills bacteria, viruses, and fungi very effectively with zero adverse effect on human cells. So you can selectively kill bacteria. Unfortunately, our government feels we shouldn't be using it in dentistry. Now, there are some dentists that use ozone in this country, and they're using it illegally, at the risk of their license. So, in my opinion, I want to be around with my license to help people. I choose not to use ozone because I don't want to risk my license. So, there are, good guys and good women out there who smuggle ozone machines from Canada, from Australia, from Mexico, and they're helping people with it, but at, I think a great risk to their careers, which, I think is dangerous. So
and we don't want you losing your license either, because we love a dentist who loves what he's doing. So
and about ozone, there are alternatives to ozone, like lasers that are legal and, also effectively kill bacteria. So, I use lasers a lot.
Mm-hmm.
Excuse me?
No, so there are options out there. We don't have to do ozone.
There are alternatives to ozone that are legal, and FDA approved. So.
Okay. All right. And so, we are in our last few minutes of the show. You shared so much wonderful information, and actually, I had so many other questions for you, and so you have to come back. But I love to leave my listeners with a tip of the week because, and you actually gave so many already, but I love to have a call to action, and so they like to know what to do, what one thing they can do this week. And so for you, what is the single most important thing that you think our listeners should do today to ensure that they have healthy teeth for a lifetime?
I just read a very interesting study this weekend, and that 3 out of 10 people in this country don't see a dentist at all. And I think at the very least you should do is have an examination. A lot of dental disease doesn't hurt. So gum disease is we call it the painless epidemic. A lot of tooth decay doesn't hurt. When your tooth hurts, it's really bad. A lot of damage has been done. And most cavities don't hurt. And surprisingly, I have seen massive infections and tumors in people's mouths, and they were completely unaware. So please, please, please get a checkup and go to a dentist that spends time with you. Unfortunately, the insurance industry is forcing dentists to rush and, not spend the adequate amount of time with the patients. Find a dentist, make the choice with your dollars. Find a dentist that spends time with you. A cleaning should take an hour, not 15 minutes. So go to a dentist who's thorough, choose with your dollars, make the right choices. And I think if the population as a whole makes the choices, then the industry will be forced to make changes.
That's sage advice. How can our listeners get a hold of you or get a hold of your book?
They can go on my website. It's SmithtownSmiles.com. I also write a blog on my website. Read it. I write about all the new articles and all the new studies that come out that pertain to dentistry. You could learn about lasers and root canals, and all the information we talked about today is on my website, SmithtownSmiles.com. And just kind of read through it. I encourage you to read my blog. You can find me on Facebook. I share my blog to my Facebook page, and just educate yourself.
Wonderful. I actually read some of your blogs, and they're really great. They're filled with great information. So I too encourage people to go there and get some information. Yeah. And so of course
I'd love to come back and talk about root canals.
I want you to come back. There's so much more I want you to come back and talk about. I think dental health is so important and so underrated. So I really want you to come back and we can talk more about those subjects. Again, this is Dr. Alex Shvartsman, and he's a holistic dentist, and you should check out his book. It's called Your Path to Healthier Dentistry, a Holistic Approach to Keeping Your Teeth for a Lifetime. And once again, I thank you so much for coming on the show. The link to your website, I will be adding it to my Facebook page. And again, thank you so much for coming on the show, Dr. Shvartsman.
And thank you for having the show to educate the public. I think we're doing a phenomenal service to the people.
Yes, thank you so much. I really believe that people should be empowered with information so they can make good health decisions. Yes.
Absolutely.
So, again, thanks. All right. Take care.
Take charge of your health.
That's right. There you go. Bye-bye. All right. That was Dr. Shvartsman. And, again, great information. His book, again, is called Your Path to Healthier Dentistry, a Holistic Approach to Keeping Your Teeth for a Lifetime. He had a lot of great information, and you really should check out his website. I really think his blog was filled with a lot of great information, so you really want to educate yourself and so you can make really great health choices for yourself. I also want to thank you, the listeners, for joining me. You come every week, and you're loyal, and I appreciate it. Thank you so very much for coming. And, I knew that at the beginning of the show that you would leave at the end knowing more than what you knew at the beginning, and I know that's the case for sure. I want to remind you that your health is indeed your wealth. And many times we do nothing until we've lost our health. So please do something healthy for yourself this week. And perhaps, as Dr. Shvartsman said, the thing to do is to go make that appointment. Go make that appointment for that checkup and get your dental health under control. And one thing I want to leave you with, do something healthy for yourself. Have a great evening, everyone, and have a fabulous week.
You've been listening to Health Talk with Dr. Diane, MD. For show replays and full guest bios, please be sure to visit fmgradio.com/Dr. Diane, MD. That's DrDiane, MD.